PriorityVax, an online tool to help priority setting for vaccines within an evidence to recommendation framework. Users are taken through the process of comparing different vaccines or vaccine characteristics as part of priority setting and decision making. Over the last 20 years, the successful investments of the philanthropic and donor community, along with innovative financing of Gavi, the Vaccine Alliance, have resulted in the accelerated access to and use of over a dozen new vaccines in low and middle income countries. Resources are never unlimited, but in environments facing considerable financial and functional constraints, health systems and donor organizations increasingly recognize the need to support well-informed processes for priority setting, critical process of selecting between alternatives and balancing competing needs that account for local context. Effective and especially sustainable decisions for new and underused vaccines, or between alternative vaccine products, requires locally relevant information and decision maker expertise that are aligned with the public health needs of the population and couched within a country's context of programmatic and policy needs. PriorityVax can strengthen functional capabilities of NITAGs, the National Immunisation Technical Advisory Groups, and national decision makers for successful priority setting by supporting transparent and credible evidence-informed priority setting recommendations, promoting country ownership of decision making, and improving political commitment to and effectiveness of expanded coverage of immunisation programs. Sabin's PriorityVax platform has evolved from an initial conceptual framework that emerged from priority setting and early stage tools developed by the US Institutes of Medicine and the NIH's Fogarty International Center. The Sabin Vaccine Institute is a leading advocate for expanding vaccine access and uptake globally, advancing vaccine research and development, and amplifying vaccine knowledge and innovation. As a non-profit with more than 2 decades of experience, Sabin is committed to finding solutions that last and extending the full benefits of vaccine to all people. Sabin's vision for PriorityVax is to make this valuable tool more widely available to promote appropriate and sustainable vaccination around the globe. While it won't and shouldn't make the decision for you, going through the steps of PriorityVax encourages users to think about different, sometimes competing, priorities that are important to shaping vaccine-related decisions. In a stepwise process, the platform directs you to select input from your data, target population, disease profile and vaccine options, then identify the country's vaccine needs and key elements of your decision-making process, the attributes or criteria that guide your decision. You have the option of selecting from a pre-populated list or creating your own. Attribute weights then reflect the importance of each criterion. They can be equal or represent differentiating elements important to decision makers. Then PriorityVax displays your results,
showing how each vaccine scored based on your criteria and the evidence available.
PriorityVax is built around an apples-to-apples comparison, illustrating which vaccine best met the criteria set from the evidence provided. Uncertainty about data estimates used in your analysis. Uncertainty about data estimates used in the analysis, or if the group have differing opinions about the level of importance of different criteria, you can reconfigure the analysis in real time. Uncertainty about the data estimates used in your analysis, or if the group have different opinions about the level of importance for decision attributes, you can reconfigure the analysis. You might have access to new data, want to explore a range of published values, or explore different future conditions, such as the costs post-co-funding. This tool is designed to explore different perspectives and facilitate consensus building in your process. A key feature of this is the ability to reconfigure the analysis. In an easy-to-share report, PriorityVax produces not only analytic results, but also a visualization of how these results have been achieved.
The shareable report
provides a transparent view of your decision-making process, the data, inputs, weights, and information resources, as a way to communicate and support the recommendations or policies resulting from your process.
This decision matrix can be used to facilitate exchange with immunisation stakeholders,
such as practitioners, ministries of health or finance, public health agencies, and donors. These reporting capabilities provide documented, reproducible record of the decision-making process and demonstrates the use of data and evidence. Development of a repository of data and information used in the process, including a bibliography and the process notes. A key enablers transparent information sharing that highlights and distinguishes between importance of local context for the NITAG decision-making process, consideration of locally relevant disease epidemiology, and other programmatic constraints and priorities. Priority VAX is a tool that aids in guiding and defining an evidence-informed priority setting process. The tool's outputs include transparently capturing the components of the process and the data so that it can be most effectively used to influence decision-making and implementation of vaccine and immunization policies. The tool's outputs include transparently capturing the components of the process and the evidence so that it can most effectively influence decision-making and implementation of vaccine and immunization priorities.